Dr. Sabrina Solt here, and for my very first YouTube video, I'm going to be talking about the 3 things that you need to know to be a smart consumer of a stem cell procedure. Now, over the last couple of years, we've seen a huge surge in stem cell clinics pretty much across the country, and some of these are doing it right, and some of these are towing the ethical line, if I do say so myself. So what are the 3 things that you need to be looking for when you're deciding on your stem cell treatment? I'm going to go through them right now really quick, and then we're going to dive in a little bit deeper. So in case you need to jump off of this within the first minute, you at least got your information. First thing, decide on the source of the stem cells. 2, figure out who's doing your procedure. And 3, consider the cost. All right, so let's talk about the first one, the source of the stem cells. There's a lot of clinics out there that are saying they're giving you a stem cell procedure when in reality, they're not. So what do I mean by that? Well, the only way you're going to get a stem cell procedure is if they're removing stem cells from your own body, meaning from bone marrow or fat tissue, okay? There is no other way to get live stem cells. Now, if they're offering you an off-the-shelf product saying that it came from amniotic fluid or cord tissue or even cord blood, those do not have live stem cells, okay? This is something that I can dive into on a whole other video if you need me to, but just take my word for it at this point. There are no live stem cells in any of those products. I actually heard of a doctor that when confronted with this, he goes, well, I didn't tell the patients they were live. Meaning, yes, there are stem cells in them. Oftentimes they are dead by the time they reach you, and that's because of the cryopreservation and everything they have to undergo. So, no live stem cells in off-the-shelf products. You can only get live stem cells in a procedure that involves a minor surgery, meaning they are harvesting them from your own bone marrow or your own fat tissue, okay? That's the first thing you need to consider when deciding on your stem cell treatment is, am I getting real stem cells, okay? Number 2, who's doing it? Is it a doctor? Is it a nurse practitioner? What's their training look like? Is this something that they just kind of do on the side in addition to their OBGYN practice or their family practice? Or is this something that they are doing as their main career? You want someone who's focused, and it doesn't even necessarily come back to what their designation is. It just means, is this their focus? Are they all in with regenerative medicine? Because that is the umbrella that covers stem cell treatments, okay? Are they a regenerative medicine practitioner? Are they skilled with a needle? Are they skilled with their procedures? These are all things that you need to be considering. Again, a nurse practitioner could be doing this. MDs, DOs, and I'm an ND, and this is what I do, okay? But just make sure that your provider is all in this and that they know what they're doing, okay? Ask how many procedures they've done, how many knees they've injected. You know, if they're in the 5 to 10, 20 category, maybe find somebody else, okay? You want somebody with experience. Third and final thing that you need to be considering is cost. Now, stem cell procedures, relatively, they're not cheap, okay? But what we're looking for is we're looking for cost reflective of the value that you're getting. Now, I've heard horror stories. I've heard of people paying $13,000 for a cord blood IV. Now, there is so much wrong with that. Cord blood, again, it's another video. But $13,000 is absolutely outrageous for a single treatment. Ballpark, depending on what you're getting, anywhere from $3,500 to $10,000, okay? Now, when we're looking at $10,000, we are looking at least in my practice, things like a full adipose procedure harvest, meaning you got the liposuction in there. You're also getting processing of the stem cells, which is about an hour or so of my time. And with that, we're injecting anywhere from an IV, a couple joints. We might even be sending your stem cells to the bank. Like that $10,000 is like the Rolls Royce of stem cell procedures. You know, on the $3,500 end, we're talking like a bone marrow procedure, hitting a joint or two. So realistically, that's kind of the span, and that's, you know, reasonable based on what you're getting. Again, I've heard horror stories of people paying $8,000 for 2 knees with amniotic products. So again, not even real stem cells. So really just make sure you're considering that. In addition to all of this, You also just want to jive well with the office that you're going to. I mean, just really make sure that you're being taken care of. You don't want to end up in a high pressure sales situation where you're sitting across from them and they're saying, sign on the dotted line and we're going to get you this procedure tomorrow. Make sure they're really doing their due diligence, that they're screening you, making sure you're a good candidate, taking you through a physical exam. And the other thing too is that find somebody who's going to help optimize your treatment, okay? We know that some stem cells are actually signaling cells. And the other signaling cells that are in your body are actually hormones. So if you really want to optimize your stem cell treatment, find somebody who's going to work with you on these other levels, like your hormones, even your nutrition, your lifestyle, to really make sure you're going to be getting the best outcome, okay? Because that's ultimately what your doctor should be looking for, not to fatten their bottom line. All right, that's all I wanted to get across to you guys today. Hope you enjoyed this quick first video. Drop some comments, subscribe. I'll be putting more content out. Let me know what you want to hear. Here to serve. Thank you.